umabot ng, for example, nagplato siya or nag-half-life na siya by night. So baka yung pasyente pag matutulog, uubo-ubo ng madaling araw. So mas maganda, ibigay siya sa night. Another, Ebola is not contagious until a person is symptomatic. That is true. Okay? Because Ebola can be transferred to other if naging symptomatic na yung pasyente. But if your patient is asymptomatic, hindi siya nakakahawa. Number 9, which immune response does MERS-CoV evade? It's your innate immune response or the non-specific response. Number 10, MERS-CoV defined as your Middle East Respiratory Syndrome coronavirus. Okay? So that's it. So again, later I'm going to post the top scorer for the quiz. So, ayan. For those student na hindi mapopost yung name, you could message me na lang kung ilan yung grade ninyo. Okay? Basta ang ipopost ko is yung mga nasa line of 8 muna. Okay? Any question, nurses?
Wala naman po.
Okay. Okay. So if wala na kayong question, we're going to discuss na. Okay? Okay. So ang iano lang natin dito is the asthma part. Okay. So we're going to discuss asthma. Okay? Usually, ang asthma could be inherited from your parents. Okay? But it doesn't mean na ang family niyo walang asthma, hindi ka pwede magkaroon ng asthma. Still, there is a chance. Pero mas malaki ang chance if sa mga parents mo, meron silang asthma. So the definition of this is a periodic episode of reversible bronchial obstruction. Ibig sabihin, it could be managed and pwede siyang matreat. Okay? And in people with hypersensitive airway. So you're going to observe, itong mga pasyenteng asthma to hirap na hirap huminga. Why? Because of its pathophysiology. What happened on the airway? There is a bronchospasm or narrowing of their airway or the bronchi and get constricted bronchi, which causes your wheezing. So what do you mean by wheezing? Ito yung parang musical note na narinig nyo or parang pito pag ang pasyente ninyo humihinga. Commonly, your wheezing can be heard upon inspiration. Okay? Pag inhale or pag inspire, meron silang parang musical na kayong maririnig. Okay? So that's your inspiratory wheezing. But in severe cases, that inspiratory wheezing could also be heard upon expiration. Another, there is a bronchial inflammation and get edema and mucorrhea. So what does it mean? By the narrowing of the airway, there is a production of mucorrhea or mucus. So by the way, on your idea, what is the pathophysiology behind edema? Montesilio, Sir Robert. Any idea what's the pathophysiology behind edema? Andaya Mitch. Okay, so in edema, there is an accumulation of fluid in the interstitial space. By that, it may lead to edema or in Tagalog, manas. So in airway, there is a bronchoconstriction na nga, okay? Meron ka pang bronchospasm. Aside from that, magapa yung daanan ng hangin. And meron pang manas. Tapos meron ka pang mga mucus secretion. So can you imagine the airway very compromised ang gas exchange and compromise yung perfusion. Mucorrhea leads to obstructive plug. And by these three factor, okay, asthma will lead na, okay, or may occur. So itong tatlong ito, importante ito na tinitreat to those patients na may asthma. That's why if you're going to give medication towards your asthma, this pathogenesis is being targeted by your medication. So two key pathogenic mechanisms are bronchospasm and your inflammation. So in this image, you could notice that the edema of the mucous membrane, which causes narrowing, and there is a mucus plug, and there is a bronchospasm, which causes the muscle contraction. So in here, there is inflammation. So from a wide airway, so it could narrow by that. Okay? Tsaka yung mga pasyenteng may asthma, ang pakiramdam nitong mga to is naglalakad sila sa dagat tapos yung tubig hanggang sa leeg nila. Actually, ganun ang pakiramdam nila. And nag-hyperventilate sila minsan. Another, the etiology again is immune system. So here, actually, ang immune system natin, because of the allergens, okay, yung balahibo ng hayop, animal or the animal danders, the climate, okay, malamig, tapos biglang magwa-warm, okay, the perfume. So those could trigger your asthma. Aside from that, pati yung mga cortina, okay? So it could lead to triggering asthma. Why? Because syempre, kung papansin niyo, pag yung cortina binukas sara nyo doon sa bintana nyo, may lumilipad na mga maliliit na dust. And it could trigger your asthma. Mas maganda pa nga yung Venetian blind compare doon sa mga cortina. Another, inflammatory reaction to an antigen from allergen or irritant exposure. Your asthma is associated with atopy if your family have a history of allergy. Another, it is a antigen-antibody reaction. So predominantly, ang immunoglobulin na activated sa asthma is your IgE. Okay, remember, di ba? You have your immunoglobulin. Your immunoglobulin is being produced by your antibodies. And your antibodies is being produced from where? Your B cells. So allergen and irritant include respiratory irritants such as dust and cigarette smoke. That's why kung may naninigarilyo sa bahay ng mga pasyente nyo, malaki ang chance puro trigger yung asthma ng pasyente nyo because of that smoke. Hindi lang yung smoke, pati yung mga nagpapabaga ng uling, mga nagsusunog sa bahay, okay, it could trigger asthma. Another, there is a exercise, especially in cold weather. So we have this term, your exercise-induced asthma, okay, because of the excessive force, okay, and hyperactivity of the body, so it could trigger asthma. Okay, may mga binag-exercise yan, biglang susumpungin ng asthma. That's why very important, meron silang dala laging inhaler nila. Okay? And commonly, ang mga inhaler na yan, dapat nag-gargle sila after. Occasionally, after mag-puff, okay, nag-gargle. Why? Because it could lead to oral candidiasis. Okay, because that is steroid, di ba? Steroid is sugar. So, pwedeng mag-oral candidiasis ang pasyente ninyo kung hindi sila nag-gargle after mag-puff nung inhaler nila. Another, the allergies, okay? You have your upper respiratory infection and other lung infection. So, pag ang pasyente nyo mayroong asthma, nagka-COVID, mas pangit yung outcome. Okay? Kasi comorbidities plus another comorbidities in the lung. Another, this causes muscle to release your histamine. The primary reason kung bakit namumula, okay, nangangate, minsan yung katawan. So, the action of this is constrict the bronchi and causes vessel to leak fluid, thus producing edema and congestion. Aside from that, you have your leukotriene and the inflammatory cytokine. So, chronic asthma can lead to irreversible damage. Ibig sabihin, kung yung asthma napabayaan for a long period of time, it could lead to certain damage that cannot be treated na. Okay? And incidence of asthma has increased over the last 10 to 15 years. And again, those patients who suddenly stop their medication, okay, or yung mga pasyenteng sobrang na-expose sa mga allergen, they could suffer from status asthmaticus. Itong mga pasyenteng to, sinusumpong ng asthma for 30 minutes, 1 hour, and that is very emergency. Why? Compromise yung airway. So again, go back to the pathophysiology, what would happen on the airway. So, nangyayari yun. So, magkakaroon ng pagsisikip ng daan ng hangin, and patient could lead to hypoxia. Okay, that's why it's medical emergency. So, ito, additional lang to. Later, we're going to discuss din. You have your COPD. COPD dati tatlo to. You have your emphysema, okay? You have your chronic bronchitis, and your asthma. But since asthma naman is reversible, so they remove asthma. Kaya ang COPD mo, dalawa na lang. You have your bronchitis or chronic bronchitis and your emphysema. And your COPD means chronic obstructive pulmonary disease or chronic airway limitation. And get irreversible progressive obstruction of airflow in lungs, which includes these three. Okay? So yung asthma mo, pwede mo lang siyang masama sa COPD if that is chronic. But if that's not chronic, you will not add that on your COPD. Okay? So general treatment plan, you're going to give you bronchodilator. Okay, that's why pag may mga pasyente, usukan sila ng salbutamol. But salbutamol side effect is tachycardia. Okay, so be mindful giving that to your patients, especially if your patient have a enlarged heart or heart problem, then may asthma. Mas magandang ibigay is your Combivent or your salbutamol plus ipratropium. Usually, pag ang pasyente may mga wheezes, ang binibigay lang dyan is salbutamol or albuterol. Commonly kasi, ang albuterol sa Amerika lang yan, wala sa Pilipinas. Meron lang tayo dito is your salbutamol. Okay? Pag ang pasyente merong wheezes and crackles or rales, so binibigay is your salbutamol plus ipratropium. Okay? Ganun ang setup sa hospital. Another, you have your mucolytic agents. Ano example ng mucolytic nyo? You have your ambroxol, okay? Another, expectorant, okay? And you have your anti-inflammatories and your antihistamine. Okay, in antihistamine, you have your H1, H2, okay? Yung H1 nyo on your pharma, those are your chlorpheniramine maleate, okay? Yung mga first generation which traverse the blood-brain barrier, that's why it causes drowsiness. Okay? Meron tayong mga bagong gamot ngayon na antihistamine, yung mga third generation, your desloratadine, levocetirizine, okay? Another, you have your antibiotics. So you're just going to give antibiotic if your patient have a superimposed bacterial infection. But if ang pasyente niyo wala namang bacterial infection, no need to give antibiotics. Okay? So, ayun siya. Okay? So, that's the important point for your COPD. So, let's go with the another slide. Okay. Here. So, additional pala doon, commonly, ang COPD sa matatanda, very rare siya na nag-o-occur sa mga bata. Unless merong mga deficiency na enzyme. We're going to discuss it later. So, the normal lung function, so the air will enter the nares or nostril or butas ng ilong, will go to the nasopharynx or the area of the throat behind the nose, and it will go to your oropharynx, area of the throat behind the mouth, and it will go to your larynx or the voice box. Will go to trachea, windpipe, bronchi, bronchioles, and alveoli. In alveoli, gas exchange happen. Okay? And in alveoli, andyan yung mga capillaries. Okay? So doon din nag-gas exchange. Okay? By the process of diffusion. And the basic functional unit of your respiratory system is your alveoli. Okay? So, by the way, what is the landmark that divides your upper to lower airway? What landmark or what structure divides your upper airway to lower airway? Crispino Micaela. Anong structure nagdi-divide sa upper airway tsaka lower airway? Lara Veronica. Manzanero Hana. Pusag Erish. Anong structure yan?
Larynx po.
Yes, very good. It's your larynx. Okay, tatandaan yun ha. That is the one that divides your upper airway to lower airway. And you should also remember that the chest cavity is composed of your right lung and left lung. Your right lung have 3 lobes and left lung is 2 lobes. Doc, bakit 3 lobes sa may right lung and sa may left lobe is 2? Because in the presence of your fissure. Okay, ano bang fissure ninyo sa right lung? It's your horizontal fissure and your oblique fissure. That's why it gives this 3 lobe. Comparing to your left lung, okay, isa lang. It's your oblique fissure only. Kaya 2 lobe lang. Another, on the mediastinum, this is the area between the lung which houses the vessel, heart, and then the esophagus. Okay, for the gas exchange, the airway deliver oxygen, okay, towards the lung. And the alveoli will offload the carbon dioxide or will remove the carbon dioxide because that is toxic to our body. So you can breathe off the carbon dioxide and it will remove the carbon dioxide in the body. So ang main goal kasi dito, so that the oxygenated blood will go on the capillaries. Okay? And from that, the red blood cells in the capillaries now, okay, yung carbon dioxide doon will be absorbed by the alveoli. Okay? And then yung alveoli, ibabalik niya or in exchange of that is your oxygen. So Pupunta si carbon dioxide ka alveoli, ang kapalit, bibigyan ng oxygen yung dugo, magiging siyang crimson red in color. And from that, oxygenated now will going to the systemic circulation. Okay? So, ganun ang gas exchange. Okay, here, in COPD, again, commonly your COPD known as your chronic obstructive pulmonary disease because, again, of its chronicity. Pangmatagalan to, and commonly, wala nang it is irreversible. So, patient is greater than age 45, commonly. And respiratory symptoms of cough, shortness of breath. And you have your FEV1 and FVC ratio. It is less than 0.7. So, reading assignment nyo na lang yung FEV1 tsaka FVC ratio. So, history of chronic smoking and other pollutants. So, ito yung mga pasyente na makikita nyo sa hospital na naka-tripod position. Okay? Tripod position means nakaharap sila sa sandal ng upuan, then yung kamay nila nakapatong doon sa may sandal ng upuan. That is tripod position. Okay? So, because of that, syempre, nahirapan silang huminga. Kaya sila naka-tripod position. So, in this patient na may COPD, it is composed of these two disease entity, your bronchitis and your emphysema. So, again, in bronchitis, it is a increased mucus in inflammation. And emphysema, destruction and enlargement of the air spaces. So, in bronchitis, ganito nagiging itsura ng airway nila. Naninikip. Okay? And in emphysema, from the normal na air sacs, which is on the left side, okay, ganito kasi ang normal. Ito nasa may kaliwa nyo. Nagiging silang dilated. So, sobrang compromised ng gas exchange. And by that, mga pasyenteng to hingal. Okay? Commonly, ito mga pasyenteng to, they cannot live without oxygen. Commonly sa hospital, hindi hina-hyperventilate or hindi pinapa 10 LPM ang mga COPD-Y because there is a air trapping. Commonly, ang mga oxygen ng mga to is 1 LPM, 0.75 LPM. Okay? Hindi sila or ayaw ng mga pulmonologists na hina-hyperventilate sila because it could lead to air trapping. So what happened? Okay, there is a air trapping which causes poor gas exchange. So here, the normal alveoli, okay, magiging siyang dilated which leads to emphysema. And the normal bronchus, okay, it would inflame, may mucus production then, which may lead to bronchitis. So in board exam, ang common na tinatanong is your blue bloater and your pink puffer. So how does it impact in the patient? So periods of acute exacerbation, okay, and increased morbidity. So let's go on this image. So how would you differentiate the two? The blue bloater and the pink puffer, okay? Sometimes in one patient, hindi lang emphysema ang pwedeng mag-exist, okay? Sometimes actually, in one individual, this disease entity could present at the same time. Pwedeng pasyente nyo ma-emphysema and at the same time, meron ding chronic bronchitis. Okay? Kadalasan actually ganun sila. Nagsasama tong dalawang to. So again, remember, blue bloater, that is your chronic bronchitis. Pink puffer is your emphysema. So symptoms, again, chronic productive cough, sputum or purulent sputum, hemoptysis, you have your mild dyspnea initially, and cyanosis, that is due to hypoxemia. Peripheral edema due to cor pulmonale or the right-sided heart failure. You have your crackles, wheezes, prolonged expiration, and those patients are obese. Comparing with your pink puffer, okay, dyspnea, minimal cough, increased minute ventilation, pink skin, and pursed lip breathing. So ito mga to, humihinga sila parang yung lips ni cartoon character Suneo sa Doraemon because mas madami silang na-expire na air if naka-purse yung lips nila. You could try comparing mo yung lips mo na hindi naka-purse versus naka-purse ang lips mo. Mas madami na ilalabas na oxygen kung naka-purse yung lip. Accessory muscle use, okay, usually nagkakaroon ng mga retractions to. Ano ba yung, on your assessment, what are the 3 areas of your body kung saan may mga retractions? You have your subcostal retraction, di ba? Intercostal retraction, and your supraclavicular retraction. Habang tumataas yung retraction, the more na nagiging toxic yung pasyente. Another, there is a cachexia. Cachexia is a group of symptoms. Okay, commonly mga payat sila. Another, there is a hyperinflation and barrel chest and decreased breath sound and takip niya. For the complication in blue bloater, okay, secondary polycythemia vera due to hypoxemia. So what is polycythemia vera? This is a blood disorder wherein those patients could develop a high level of RBC. Okay, syempre, yung katawan mo, okay, kulang ng oxygen. So what would be the compensatory mechanism? There is a production of large amount of RBC. Okay? Kasi ang nakikita ng katawan mo, kulang ng oxygen. So maglalabas ng madaming RBC ang katawan, okay, which may lead to polycythemia vera. Okay? The management for your polycythemia vera is phlebotomy. It means removal of RBC or tatanggalan ng dugo each month. Then repeat ang CBC. Aside from that, this patient also is being given the hydroxyurea medication. Okay? And aside from that, this patient also may suffer or may develop into cancer, your AML, because your polycythemia vera is an example of myeloproliferative disorder. Another, pulmonary hypertension due to reactive vasoconstriction from hypoxemia, or pulmonale from chronic pulmonary hypertension. And comparing it with your pink puffer, there's a pneumothorax due to bullae. Pneumothorax means accumulation of air in the pleural space, and weight loss due to work of breathing. Okay, so that's your blue bloater and your pink puffer. Another, these are the risk of developing COPD. Number one pa rin is your tobacco smoking. Okay, so indoor air pollution, particularly women in developing countries. So occupational exposure, the organic and inorganic dust and chemical. Outdoor air pollution, okay, the small effect. You have your genetic factor or the alpha-1 antitrypsin. Okay, isa pang additional information, may mga pasyente na minors, nagtatabaw sa minahan. They could develop mesothelioma or malignant mesothelioma. What do you mean by malignant mesothelioma? That is a cancer or tumor in the pleural space, which is the most aggressive type of cancer. Okay? So, Doc, paano yun? Kung na-expose sila sa asbestos, agad-agad po bang nade-develop ang malignant mesothelioma? No. It sometimes 10 to 20 years for it to develop. Okay? Another, may mga pasyente naman na hindi naman nag-yosi, pero nagmamanifest ang COPD. Commonly, ang COPD sakit ng matatanda. Okay? Very rare ito sa bata. But if mga bata magkakaroon ng COPD, pwedeng meron silang enzyme deficiency, which is your alpha-1 antitrypsin. Okay? Commonly, yung mga batang nagsi-COPD, pwedeng meron silang deficiency ng enzyme na alpha-1 antitrypsin. And commonly, pag ang pasyente nyo mayroong alpha-1 antitrypsin deficiency, hindi lang naman emphysema ang pwedeng mag-manifest. It could lead also to bronchiectasis and liver problems. Okay? Hindi lang sa lungs na emphysema. Another, aging and female sex, and lung growth and development, the low birth weight, and then the respiratory infection. Another is the socioeconomic status. The poor socioeconomic status is high risk of COPD. Why? Because itong mga low socioeconomic status na to, most of them is nakatira sa mga far-flung area. Okay? They are less civilized. So ang gagawin nila, magsusunog sila ng uling, kahoy, papel, nalanghap nila. In province, commonly, ang ginagawa dyan, nagpapausok sila, nagpapasiga. Okay? Without knowing that it could lead to COPD. Para ka rin nag-yosi nun eh. Another, chronic bronchitis, asthma, and infection. History of severe childhood, respiratory infection. So again, for the prevention, don't smoke. Yan pa rin, okay? Okay, when to consider COPD? Progressive shortness of breath over time that worsen with exercise. Chronic cough, okay, recurrent wheezing, and chronic sputum production. Okay. So, merong classification na ginagawa for COPD. Okay, good to know lang to. MRC or your cut. Okay, good to know. You should remember na in nursing, there are two types, okay? Good to know and must know. Pag good to know, okay lang na malaman nyo, okay lang hindi. Pero pag must know, that is sabihin, dapat alam nyo as a student nurse. Okay. Here. So, patient treatment. If your patient have a acute exacerbation, ano yung mga dapat management nyo? Siyempre dapat, you're going to advise to stop smoking na. Okay? And for long term as possible, stop smoking na din. Another, pag ang pasyente ninyo, okay, let's go with your bronchodilators. If ang pasyente ninyo may COPD, nagkaroon ng acute exacerbation, you could give your bronchodilators or your beta agonist. And the reason why is it will dilate the airway and improves the symptoms. Again, go back with the pathophysiology. Okay, this medication will target the different pathophysiological part. Okay, that's why may mga medication na ganito. Okay, so example ng bronchodilators mo, you have your albuterol inhaler and your SABA or your short-acting medication. So again, here in the Philippines, walang albuterol. Okay, salbutamol ang ginagamit. So you could give your Proventil, okay, yung mga ginagamit sa Pilipinas, your Ventolin, okay, yan yung mga example ng mga beta agonist mo that could be given in patient pag nagkakaroon sa ng acute exacerbation. Another, for the long term, you have your albuterol inhalers, okay, your long-acting. Okay, ano yung mga example ng long-acting mo? You have your formoterol, salmeterol, okay, and others. May mga puff na ginagamit combination, salmeterol plus fluticasone. Okay? Commonly, yung mga ganon, pang-chronic yon or pang-long-term na treatment sa mga pasyente mo. Pag ang pasyente mo, hindi na siya tinatalaban ng mga short-acting beta-agonist mo, you're going to give your LABA na. Okay? So, that's your long-acting beta-agonist. Another, you have your antimuscarinic. What's the function? It relaxes smooth muscle and prevent constriction. They improve health status and reduce the exacerbation. An example of this that could be given in acute exacerbation are your ipratropium, okay, or your you have your medium acting and your oxytropium. Another, you have your tiotropium or your Spiriva. Commonly, dito sa Pilipinas, binibigay is your ipratropium and your Spiriva. Okay? So, Doc, bakit ganun? May mga pasyente na nadodoble yung gamot. Meron ng bronchodilators, meron pang antimuscarinic. Okay? Because merong side effect yung gamot na gusto mo doon sa pasyente. Tsaka, you review the mechanism of action ng medication. Hindi lang binigay yan dahil nadoble. There is a primary reason. Okay? Pasyente mo meron ng bronchodilator, meron pa rin antimuscarinic. Why? Again, you go back with the function or the mode of action. What is the action of bronchodilators? It will dilate the airway. Bakit pa siya merong antimuscarinic? Okay? Para to relax the airway and improve the health status and reduce the exacerbation. That's why. Okay? Kasi yung ibang ginagawa, pag ang pasyente o gamot ng pasyente, ang dami, meron na nga bronchodilator, may antimuscarinic, binabawasan nila. No. May primary reason yan kung bakit sila binibigyan na. Another, your steroids. Okay? The prednisone, dexamethasone. And for the long term, your inhaled steroid. Okay, beclomethasone, budesonide, mometasone, and others. Tandaan nyo that if your patient is using their MDI, what is MDI? Your meter dose inhaler or yung mga pang-puff. Okay? You advise them to gargle. Okay? After mag-puff. Okay? So, on your pharma naman, I know, naturo na how to use your puff. Okay? So, importante, you're going to advise your patient how to do that puff. Okay? And importante rin, mag-gargle sila because oral candidiasis could occur on that. Okay? So here in the Philippines, commonly, pag may mga asthmatic na pasyente, mga sanggol, pumunta sa ER, tsaka adult, ang ina-advise is salbutamol times 3 doses, Q15. Sometimes Q20. Anong ibig sabihin nun? You're going to give salbutamol for 3 doses with the interval of 15 minutes. Yung iba gusto 20 minutes. Then after nun, X-ray. Okay? So, ganon. Tapos yung iba naman, check din yung autosaturation. May iba rin mga sa hospital, ang ginagawa nila, salbutamol, okay, 2 doses plus 1 dose of budesonide. Okay? So, iba-iba yan. Pero as of sa level nyo, importante, meron kayong idea kung paano binibigay itong mga gamot na to. Okay? So, isang complication pala ng mga salbutamol or albuterol is tachycardia. Okay, so be mindful in giving this towards your patient. Kung ang pasyente nyo may sakit sa puso, mas maganda, you give your Ventolin na or your salbutamol plus ipratropium instead of your salbutamol or albuterol. Kasi yon less siyang nakaka-tachycardia. Okay? And aside from that, in asthma patient, you're not going to give your beta blockers. So, bawal magbigay ng mga may LOL sa dulo, metoprolol, atenolol, sa pasyenteng may asthma because it may lead to status asthmaticus. Okay? Tandaan niyo yung mga yan. Tsaka pag mga pasyente nyo may problem sa heart, mas magandang ibigay nyo yung combination na kaysa doon sa nakakapag-cause ng tachycardia. Next. Okay. So that's it. Yung mga important na alam nyo na regarding your COPD. Okay? So let's go with your GBS. Any question ba, nurses? So, pag nasa health center kayo, may pupunta sa inyo, okay? So, magtatanong sa inyo yan, anak ko po may hika. Again, kahit gaano kaganda ang NCP nyo, kung ang pasyente nyo napapalibutan ng mga bawal, walang use ang NCP. Okay? Importante, you target the etiology rather than addressing the symptoms. Okay, yung pasyente nyo, asthma, laging sinisipon, inuubo, you ask, meron po ba kayong alagang hayop sa bahay? Okay, na paano po ba kayo naglilinis sa bahay? Okay? Kasi yun dapat yung ma-address ninyo. Kaya nga mas maganda minsan kung magpupunas sila ng mga pasamano, yung pamunas na medyo basa kesa sa tuyo. Kasi yung tuyo pwedeng mailipad yung mga dust. Comparing doon sa basa, it will absorb. Kaya yun yung isa. Another, mas maganda yung Venetian blind comparing sa mga curtains. Okay? So, syempre yun, dapat magmamask din sila. Kaya ganun. So usually ganyan. Tsaka yung mga alagang hayop, pusa, aso, yung mga animal danders. Okay? Minsan pag malamig yung climate, mainit, those could trigger asthma. Aside from that, acid reflux could trigger asthma. Kaya yung mga mga pedia patient, commonly, pag nagre-repeated yung asthma nila, so tapos mataba sila, more likely baka nag-acid reflux sila, kaya natitrigger yung asthma nila. Same with adult, pwede yun. Okay? Tsaka ang asthma, sa totoo lang, hindi naman nawawala yan. Okay, andiyan lang yan. So, pwede siyang matrigger, okay, pwede siyang latent lang, tahimik lang siya. Okay? So, ayun, yung mga importante sa asthma. Tsaka airway lagi, dapat lang check nyo sa pasyenteng may asthma. Okay? So, yan. Any question ba, nurses, regarding COPD and asthma? Okay, if none, let's go to your GBS or your Guillain-Barré syndrome. Yung GBS actually, parang mamahalin yung pangalan niyan, okay? Guillain-Barré syndrome. So overview regarding your GBS, it occurs here in the Philippines, okay? May mga pasyente kami na may GBS. Okay. It is a rare disorder that mostly affects the nerves of the body. It occurs because the immune system attacks part of the nervous system. Okay? This GBS is a type of autoimmune disorder. What do you mean by autoimmune disorder? It means the body attacks its own. Okay? There is a misidentity. Okay? Because of the hyper reaction of the immune system, it attacks its own. Okay? Another, the first symptom are usually weakness, tingling, and numbness in the extremities. This GBS is a ascending paralysis. What do you mean by that? It is from the foot towards your brain. Okay? So, mnemonic unity is ground to brain. Kaya siya GBS. G stands for ground, B is brain. So, pataas siya. Commonly, ang mga pasyenteng to, ang first na nawawala sa kanila is your deep tendon reflex. Okay? Kaya on your neuro-PE, dapat na-check nyo using your Eurohammer yung mga pasyente ninyo. Akala nyo simple weakness lang, yung pala nag-GBS na. Nawawalan na siya ng DTR or the deep tendon reflex. Okay? Di ba ang normal doon is +2. Okay? Another, the exact cause of the syndrome is still unknown. But different theory says it is an autoimmune or the body attacks its own. Another, there are treatments that reduce the severity of the disease and relieve its symptoms. Okay? We have a patient last time in Maddox. Okay? So, meron na bakunahan siya ng COVID-19 vaccine. Okay? Pero hindi naman siya nag-GBS actually. Ibang autoimmune disease yung tumama sa kanya. Ang tumama sa kanya is your myasthenia gravis. Okay, i-discuss natin siya on your midterm. Okay, so good to know. Another, it is a rare disease in which the peripheral nerve are attacked and damaged by the immune system. It occurs at all age but more commonly in adults with varying degree of weakness. Although rare, it can lead to complete paralysis of the body. The most dreaded complication of your GBS is respiratory arrest. Okay, kaya babantayan nyo sila kasi yan yung pwede nilang ikamatay. So, the types is you have your AIDP, which is the most common. So, you have your Miller-Fisher syndrome. Okay? May mga pasyente na may GBS that is associated with ophthalmoparesis and ophthalmoplegia. Okay? So, yun ang importante dyan. Next, the cause of GBS is unknown, but it is often preceded by infectious, viral, or bacterial disease, such as respiratory infection. Commonly, mga pasyenteng to nagka-flu, okay? Nagkaroon ng ubo, sipon, then after 2 weeks nag-GBS. Pwede yun, okay? Commonly, ang etiologic agent when it comes to respiratory is H. influenza. Okay? That's why your GBS is preceded by infection. That's why pag may pasyente kayong GBS, tanongin niyo muna, before po ninyo naramdaman ito, going back, okay, nagkaroon po ba kayo ng sipon, ubo, okay, because those could lead to GBS. Aside from that, your GI infection, commonly your Campylobacter jejuni. Okay, nag-diarrhea. Okay, after a week or 2 weeks, nag-GBS yung pasyente. Okay, yun yung common na causative agent dyan. Another, the immune system begins to attack the nerve ending which causes the damage. Commonly, this GBS attacks your myelin sheath. And myelin sheath is what? What's the function of myelin sheath? It's a insulator. It prevents the disrupted release of chemical impulses towards the brain, okay, or in the brain. Kaya maganda yung sendang impulse. Okay? Kaya pag nasisira yung myelin sheath, sabog ang impulses. Kaya nagmamanifest din yung GBS. Another, inflammation in the layer coating the nerve or your myelin sheath, and thus preventing the nerve from transmitting nerve signal to the brain and leading to weakness, numbness, and paralysis. Okay, recall, what type of cell does produce your myelin sheath in the central nervous system? It's your what? It's your oligodendroglial cells or oligodendrocytes. Okay? Those cells will produce your myelin sheath in the central nervous system. But how about in the peripheral nervous system? It is being produced by your Schwann cells. Okay? Schwann cells. Okay? I know you already heard that. So these are the risk factors. You have your age, okay, viral or bacterial infection, especially the Campylobacter in the GI tract. But if that is in the respiratory system, that's your H influenza. Another, the surgeries, lymphoma, and AIDS. Okay, aside from that, vaccine, your flu vaccine, COVID-19 vaccine, pneumococcal vaccine, or any type of vaccine may lead to GBS. Okay? Again, going back sa nakwento kanina, yung pasyente namin, although hindi siya GBS, but that vaccine, yung COVID-19, pwede pa rin siyang mag-lead into this autoimmune disease. Okay, yung pasyente na yon, nag-develop siya ng weakness. Okay, yung ibang hospital, they diagnose it as stroke. Okay, pero normal. So, tinakbo sa amin. Okay, na-check ng neurologist, etc. Then to find out that is a post-COVID-19 myasthenia gravis. Okay, that is a very reportable case. Okay, so nagkaroon siya ng autoimmune disease due to COVID-19 vaccine. Naka-second dose siya nun, wala pang booster nun. So, ayun, nakita, meron siyang thymoma or tumor sa thymus and needs to be removed. Kasi pag hindi na-remove yun, actually, the myasthenia gravis could reoccur. Babalik siya, manghihina yun. Mag-facial drooping, mag-pipitosis yun, or weakness ng eyelid niya, parang kikirat ang mata nun. Okay? So, the mainstay management for GBS is your immunoglobulin. IV immunoglobulin. Okay? So it costs 250,000 per vial. So can you imagine that patient? Yung pasyente namin na yon, nag-IVIG for 10 days. So 250,000 times 10. So mahal siya. Okay? And it is being given once a day. So sobrang mahal. So what's the rationale for that? Siyempre, the immunoglobulin, okay? That's an immunomodulator. Another, you have your plasmapheresis or deep protein exchange. What happened on that? Okay, it removes the antibody on the immune system. That's the rationale of your IVIG or your plasmapheresis. Okay, it removes the antibodies. Another, pinapagawa dyan is spinal tap or the lumbar tap. Normally, di ba sa CSF natin, ano ang madami glucose? But in this patient, ang mataas is your protein. And that's what you call your albuminocytologic dissociation. Again, that's your albuminocytologic dissociation. Okay? Albuminocytologic dissociation. So for the symptoms, there is a numbness, tingling, and weakness in the extremities. There is unsteady walking, difficulty with eye or face movement, rapid heart rate, low or high blood pressure, and difficulty of breathing. That's why ang mga pasyente nyo, pag nag-rounds kayo together with the nurses, endorsement, auscultate nyo rin yung lungs. Okay? Check the autosaturation. Okay? Not just checking the fluids or others. And for the complication, again, difficulty of breathing, heart and blood pressure disorder, problem with bowel and bladder function, permanent numbness, thromboembolism. Okay, in the patient na merong bowel and bladder function, commonly itong mga pasyenteng to nasa plateau phase na ng GBS to. Pag pasyente nyo, okay, hindi umiihi na yan without loss of control, then meron na siyang bulbar symptoms. It means yung mukha niya affected na, commonly nasa plateau phase yan. Wala na kayong magagawa dyan. That is already bed-bound. You just prevent to develop na lang na bed sore. Another, those patients is being given anticoagulant, your enoxaparin, okay? Because itong mga pasyenteng to, they could develop your thromboembolism. Commonly in the, on the lower extremity, diba? The deep vein thrombosis. Kasi hindi sila nakagalaw. So they are very prone to developing thromboembolism. We have this Virchow's triad. What is Virchow's triad? V-I-R-C-H-O-W. Virchow's triad. Okay? Tatlo yan. You have your number one, which is the most important, endothelial injury. Another, you have your venous stasis. Third, you have your hypercoagulability. Again, virtuous triad, you have your endothelial injury, which is the most important risk factor. You have your venous stasis and your hypercoagulability. If this three is present towards your patient, there is a greater chance that they could develop your clot or thromboembolism. Kaya nga yung mga pasyenteng nakahiga, ginagalaw-galaw nyo. Not just to prevent ulcer, but also to prevent thromboembolism. Tsaka minsan, di ba, pag nasa mga airplane kayo, ginagalaw-galaw yung paa, okay? Because you are high risk to develop thromboembolism. Okay? So commonly binibigyan ng mga enoxaparin, okay, or declexane that is injected via subcutaneous or via fat. Another, complete paralysis of the body and bed sores. And for the diagnosis, it is difficult to diagnose GBS in its early stage because of the many disorder that may manifest with similar symptoms. So commonly, itong pasyenteng to, meron siyang lower extremity weakness. So ano yung mga ibang sakit na pwede mag-manifest din? Hypokalemia or pag mababa ang potassium sa katawan. Okay? So yung mga yan. So commonly, ang GBS, you're going to diagnose it by PE. That's why health assessment is very important. Okay? If you're good with your health assessment, malaking chance na nasa early phase pa lang yung pasyente nyo, makikita nyo na kung ano yung problem. Okay? Meron tayong ginagawa dito sa GBS na laboratory. But actually, sometimes it takes weeks pa yung result nun. Another, the medical history, you're going to ask if there's infection, anong vaccine nakuha, nagdiarrhea ba, nagkaubo si lagnat, okay? And take a sample from the spinal fluid or the lumbar puncture. Again, ang titignan doon is the number of protein. Normally, your CSF, okay, dapat ang glucose mataas yan. But in GBS, okay, mababa ang glucose, mataas ang protein. Okay, and that is your albuminocytologic dissociation. Okay, so ayun siya. And for the management, there is no known cure for this syndrome. But there are drugs that reduce the severity and elevate the symptoms. Includes your replacing the plasma or your plasmapheresis to get rid of certain antibody that contribute to the immune system attack on peripheral nerve. Okay, again, anong tinatanggal mo sa plasmapheresis or the protein exchange? It's your antibodies. Okay, because this antibodies triggers also the autoimmune episode of your patient. Another, immunoglobulin or your intravenous immunoglobulin. And this contains antibodies taken from blood donor to block the antibody causing the damage. Another, drug to relieve the symptoms such as analgesic. Okay, another, rehabilitation to physical, functional, and speech therapy. And for the prevention, there is no prevention measure that can be taken to prevent the disease, as its cause is still unknown. Okay? And again, commonly asked question, it is a genetic disease ba? No, it's not a genetic disease. And it is not transmitted from one person to another. Another, how long does it take to recover after treatment? So the period varies depending on the several factors, including the severity of the disease, how fast the diagnosis is made, and the treatment plan is initiated. Siyempre, kung nahuli ng mas maaga yan or mas nakita nyo yung prognosis in the early stage, mas malaki ang chance na masasalba nyo yung patient. Okay? The body responds to treatment and the neurological symptoms in particular and other symptoms is general. Okay? Actually, this GBS, yung grandmother ko, nagkaroon siya ng GBS. Okay? But nakita ng mas maaga. Okay? Nagpa-plasmapheresis siya, ganyan. And she's okay right now naman. She's 88 years old. Okay? So again, early detection from GBS is very important. Okay, that's why history taking PA dapat talaga nagagawa yan, hindi yung copy-paste or what. Okay? So that's it. Any question ba regarding GBS? Wala. Okay? So let's go with STI na lang muna.
Sir, may tanong lang po ako about
Yes,
po
ano yan?
virtuous triad po. So, ang
Okay.
pinakamataas, kasi po sa po is parang triangle po siya.
Oh, yes. Oo.
Yung pinakamataas
Actually,
is stasis at blood flow po ba?
Ano?
Kasi po, triangle po siya, then may nakalagay po is stasis of blood flow, endothelial injury, tsaka po, yun po ba yun?
Hypercoagulability.
Yes.
Yung pangatlo?
Bali, di ba sir, triad po siya? Bali, severity po ba tinutukoy dito?
Actually, yung triad na yan, okay? Kaya may mga triad, ibig sabihin, those are the factors that can contribute to a particular disease. Okay? Ibig sabihin, in the presence of those three, high risk yung pasyente nyo to develop a particular disease. Okay? Kaya nga actually, hindi lang naman virtuous triad ang meron tayo. We have Charcot's triad in multiple sclerosis. We have Cushing's triad increase in ICP. Because yung mga triad na yan, okay, pag nakita nyo sa pasyente yan, malaki ang chance ang pasyente nyo magde-develop ng certain disease na under nung triad na yon. Okay? Sige. May question pa? Okay. Okay, sige. Basta ang importante doon sa tatlo is the endothelial injury. Okay? Kaya siya triangle din kasi nga triad siya. Okay? Another, let's go to STI. Okay. I don't know kung saan kayo nag-duty ng infectious niyo, but here in Manila, ang isang example ko sa inyo is the San Lazaro Hospital. Okay? Commonly here in San Lazaro, we don't call our patients na commonly HIV/AIDS, ganyan. We don't call them na, si patient ganito, meron siyang HIV/AIDS. No. Ang code namin is meron siyang H4. What is H4? HIV stage 4, which is your AIDS. Okay? So, hindi naman siya tatawagin ng totoo niyang sakit. So, H4, okay, itong pasyente to H4. And then, yung mga pasyente, hindi Juan de la Cruz or full name ang nakalagay sa chart. It's a code. Okay? So, yung privacy namin doon sa mga pasyente doon. So, walang pagkakakilanlan as in. Okay? So, let's go with the STI. Number one is your syphilis. So, let's define first what is STI. Okay? So, earlier, yung STD, ang ginagamit na term dyan is STI or your sexually transmitted infection. Naging siyang STD or the sexually transmitted disease. Then, naging siyang venereal diseases. Okay? Venereal disease, ibig sabihin STI din yan. Okay? These are the group of communicable infections and diseases that are transmitted by sexual contact and caused by a wide range of bacterial, viral, protozoal, and fungal agent or the ectoparasites. Another, the transformation of STI, okay, and these are the different pathogens, which are sexually transmitted, has expanded from 5 classical venereal diseases, including more than 20 viral infection. Another, okay, so these are the different classification of STI agents. So in microbiology, discussing the morphology of the virus or the bacteria. Here naman, we're going to go on the clinical side. So the causative agent of syphilis is your Treponema pallidum. Okay? And your syphilis is a painless ulcer. So parang merong warts or may ulcer doon sa are, commonly sa may glans penis or parang doon sa head ng penis, hindi siya masakit kahit hawak-hawakan. And that's syphilis, that is a painless ulcer. Comparing to your chancroid or caused by your Haemophilus ducreyi, that is a painful ulcer. Okay? Masakit pag hinahawakan. Next, you have your Calimacobacterium granulomatis. Okay? It could cause your donovanosis. Another, the bacterial vaginosis caused by various microbial agents. Okay, in your OB-GYN, you have your Amsel's criteria, di ba, on your bacterial vaginosis. Give me one example of your Amsel's criteria. Bio-ayo. Ano yung Amsel's criteria mo ng bacterial vaginosis? Bravo, Lorraine. Bukis Raven. Give me one lang from your AMSALS criteria. Okay, sige. You recall ha, the AMSALS criteria. But in the AMSALS criteria, you have your clue cells. Okay? Commonly, pag nag-check ka ng bacterial vaginosis upon microscopy, merong clue cells. Okay? So you recall na lang what is AMSALS criteria. Another, you have your Neisseria gonorrhoeae. Okay? Which causes your gonococcal urethritis or your GU. Okay? And sometimes it causes your gonorrhea or tulo sa lalaki. Okay? Ang gonorrhea could also occur in female, but ang pangit nga lang, hindi siya agad mag-manifest sa babae. Kaya nakikita siya, may complication na. Another, the chlamydia trachomatis, which causes your NGU or your non-gonococcal urethritis. The most common na STI and the fastest spreading STI is your chlamydia trachomatis. That's the number one. That's the most common. Aside from that, these chlamydia trachomatis could also lead to blindness. Okay? Another, you have your Mycoplasma hominis and your Uroplasma urolaticum. Commonly, this Uroplasma urolaticum could also cause UTI. Okay? So, di ba, what is the most common causative agent of your community-acquired UTI? It's your E. coli, di ba? But pwede rin magkaroon ng UTI caused by Uroplasma urolaticum. Pero pag ganyan, commonly STI yan. Kaya pag sa male, nag-UTI ang lalaki, hindi lang basta UTI or what yan. Kailangan pang itest yan kasi baka nag-STI din yung lalaki. Okay? So these are the different bacterial agents na commonly ma-encounter nyo sa health center. Okay, another example. Nung papasok ko sa hospital noon, so dala ko yung code ko, nag-taxi ako. Then, syempre, nagtanong taxi driver, Doc, may tanong po ako sa inyo. Kasi po, aminin ko na, sabi yung ganyan. May isa siyang pasahero, siguro lalaki niya sa mga pa-50 na. May pasahero siya 20s. So, may nangyari sa kanila. Then, nagkatulo siya. So, ang tanong siya sa akin regarding the medication. So, syempre ako, to save humanity, nagsabi ako. So, commonly, pag ang pasyente niya may tulo, binibigay is ceftriaxone. Intramuscular yon, magdidilute ka ng 2 cc of water. Then, you're going to inject intramuscularly. Okay? Masakit yon pag in-inject. Okay? Then, aside from that, your gonorrhea kasi sometimes may coexist with your chlamydia. That's why, aside from the ceftriaxone that is being given for gonorrhea, nag-azithromycin pa single dose. Okay? So, ayun. Kasi yung gonorrhea, chlamydia, may coexist at the same time. So, ayun. Ginamot ko siya. Okay naman na. Then, ang sabi ko na lang, okay, hanapin mo, ay yung misis mo, sabi ko sa kanya, huwag mo na kayo magko-contact until, sabi ko, nawawala na yung symptoms mo. Okay? Again, be monogamous. Kasi ping-pong yan. Okay? Pwede mong ma-infect yung partner mo. That's why in treating those STI, you're not just going to treat the patient per se. Lahat ng nakakontak niya. Kasi patuloy ang pagkalat nan kung isang pasyente lang ginamot mo. Okay? Another, you have your viral agent. You have your herpes simplex virus 2 or 1, HSV 2 and 1. So you have your HSV 1 or your labialis because it occurs on your lips or sometimes on your mouth. Okay? Pag yung 1, yan yung mga mamaso, mababa lang ang immune system, ganyan, okay? And number 2 is your genitalis. It could be seen on the genital area. But may mga cases na due to immune system lang siya na bumaba, ay yung iba naman due to sexual transmitted disease. Again, commonly your 1 is labialis on your mouth, genitalis by 2. But due to several practices in sexual, your oral sex, okay, other, yung 2 pwedeng mapunta sa lips, sa 1. Yung 1 pwede mapunta doon sa genitalia. Okay? Nag-interchange na sila. Okay? Another, you have your hepatitis B virus. Later, we're going to discuss this. You have your HPV, which causes your warts. Okay? So, ang warts nyo, commonly, it is serotype 11. Okay? So, may mga warts na serotype which causes cancer. Okay? Your HPV or your HPV virus na serotype 16 and 18. Okay? It could cause your oropharyngeal cancer, cervical cancer, penile cancer. Okay? So commonly sa mga ganong pasyente, may maraming sexual partner. Another, you have your molluscum contagiosum virus, which causes your molluscum contagiosum. Another definition of that, yung ulcer nito is parang umbilicated. Okay, for the molluscum contagiosum. Another, HIV causes the AIDS. So for the protozoal agent, okay, so ang amoebiasis mo, mayroong mga instances na pwede siyang maging STI. Okay? Another, your Gardenia lamblia or the Gardiasis and your Trichomonas vaginalis which causes your vaginitis. Okay, commonly, ang Trichomonas vaginalis mo, ito yung green ang secretion sa kanyang cervix. Okay, green ha, green. Pag mga green, ganyan, strawberry cervix, that's your Trichomonas vaginalis. But commonly, ang strawberry cervix hindi naman sa present in the whole population. Okay, hindi lahat merong strawberry cervix, which is a clinical sign for Trichomonas vaginalis. Another, ang Gardiasis mo, commonly to sa mga ano din, mga lake, yung mga mahiling mag-swimming sa lake. Yan. Pero pwede din siya maging STD. Another, you have your Candida albicans, which causes your candidal vaginitis. Okay, you have your Pityrius pubis, which causes your pediculosis pubis. Okay, and your Sarcoptes gabae, or yung mga mites, okay, yung sa mga balat. Okay. And for the history, syempre, pag pasyente nyo, mag-history taking kayo, you're going to ask the general history, kasama ang sexual history nan. Ilang partner, anong route ng sex, okay? Receiver ba siya? O siya yung, nagbibigay or something like that, okay? So, contact of an STI, and you're going to ask your patient in the onset of the manifestation, the character, periodicity, duration, and relation to the sexual intercourse and urination. Aside from that, if there's any anogenital discharge, dysuria, or painful urination, or hematuria. When you say hematuria, that is the blood in the urine, and there are two types. You have your microscopic, which can be seen under your microscope, and you have your gross hematuria. It means can be seen by the naked eye. You have your dysphoria, or pain during sexual intercourse. You have your pelvic pain, okay? And you have your ulcer, lump, and rashes or itching. Commonly, itong mga pelvic pain, sa OB, it's on your PID, or the pelvic inflammatory disease. Okay? Mga pelvic pain na yan. Another, ayan, you're going to ask the past medical history, the STI history, the medication allergies, and emphasis on the antibiotic and the contraception. So any STI in the sexual partner, last menstrual period. Okay, pag ang pasyente nyo, babae, you're going to get your OB history. Okay, you remember the MIDAS. MIDAS, M is menarche, I interval, D duration, A is there amenorrhea, kung nag-amenorrhea na ba siya. Okay, and you have your S if there's a if there's any symptoms na untoward dun sa pasyente. Okay? Tandaan mo ha, MIDAS. Another, for the vaccination history, ayan. Actually, di ba meron tayong Gardasil tsaka Cervarix, pwede rin siyang ibigay sa lalaki, not only in female. Another, any history of injecting drug abuse and what drug and how paano siya tinitake, okay? And any history of tattooing or blood product exposure. Commonly, yung blood tattooing na yan, common route yan, or common dyan na isped ang Hep C tattooing. Another, the number of sexual exposure, okay, single ba or multiple. Again, the greater the partner, the greater the risk to develop STI. Number of sexual partner, okay, date of last sexual exposure. Okay, may pasyente kami last time, ano siya, MSM, okay, men sex with men. So, syempre, if you're going to manage kasi ang pasyente, dapat alam mo ang whole clinical course na. So, tanong namin, ilan ba yung nakatalik mo or what? Ang sagot ng pasyente, Doc, hindi ko po alam kasi madilim. Upon digging up, yung pasyente nag-join siya sa parang orgy. I don't know if you know the term orgy, pero lately ko lang din siya nalaman. It's a group, parang group sila din, nag-i-intercourse or coitus sila. So, hindi niya alam kung sino doon sa mga yon kasi nga madilim. And hindi niya alam or hindi niya alamin kasi sumama lang siya kasama ng friend niya. Okay? So, yung mga cases na mahirap talagang i-manage. Kasi kulang yung sa history. Okay? Hindi mo alam kung saan pa pwede matransmit yung sakit na yun or saan pa siya pwedeng magkalat. Okay? Another, type of intercourse, the oral, vaginal, or the anal, and protected or unprotected exposure. Sa mga pasyente namin, if hindi talaga mapigilan or what, we advise to use lubricant. Okay? Ayan. Another, for the history, recurrent diarrhea. Okay, so sa HIV/AIDS, akala nyo diarrhea lang or what? But that could be a sign din ng HIV, the recurrent diarrhea, fever, loss of weight, genital ulcer, blood, kailangan lagi ng frequent blood transfusion, the herpes zoster, and your opportunistic infection. So what do you mean by opportunistic infection? It means ito yung mga microorganism in which hindi naman talaga nagkakos ng sakit in our body. But due to severe immunodepression of the immune system, they causes disease. Okay? Commonly, mga fungal meningitis, okay? Yung mga fungal na mga cause pneumonia, okay? Another, for the examination, you're going to assess for the genital, the thighs, and other. So you're going to inspect for the rashes, the lump, the ulcer, the discharge, and then the smell. Okay? So another, you're going to inspect for the pubic hair. Okay, baka may kuto. Another is skin in the face, trunk, forearms, palm, and oral mucosa. And palpate for the lymph nodes. So here in examination in men, so you're going to inspect the penis, okay, the external meatus. You're going to retract the foreskin. Siyempre, in doing assessment in male penis, you use your glove, not your naked hand, okay? And lymph node examination and perirectal examination. You're going to palpate the scrotum and express of any discharge from the urethra and proctoscopy. Ito, after yung ipalpate yung penis, okay, the scrotum, okay, and the whole body of the penis, you're going to parang i-squeeze nyo yung lens penis kung may secretion, kung may lalabas. Kasi, nino-note sa chart yan. Another, for the women, the external genitalia, the perineum, the anal area, the lymph node examination, okay? The speculum examination of the vagina, okay? The one that you do in your OB, the bimanual pelvic examination, and yes, it's for the oral cavity. And again, for the systemic examination, your head-to-toe assessment. Okay, let's go with the syphilis. So it is caused by your Treponema pallidum. Okay, so microbiology na yung ano dyan. Sa clinical lang tayo. Okay, so here are the transmission. Moderate to high probability of transmission. Sexual contact, the infected blood, transplacental route, and accidental to medical personnel. Another, for the pathogenesis or how this disease process or disease being developed. So syempre, the infection, which is your Treponema or the syphilis caused by Treponema, will attach to the host cell or us, the individual. And that's a corkscrew movement will be due by that bacteria, which we cause travel to the lymph node. Okay, and there is a perivascular lymphatic cause and arteritis obliterans. So it means the bacteria will invade the lymph node and then the blood vessel, which causes loss of the blood supply and causes genital ulcer towards the patient. So ang syphilis nyo may tatlo yan, primary, secondary, and tertiary. In primary, this is the stage from infection to the healing of the chancre. So incubation period is 9 to 90 days. So it means na nakipag-intercourse ka today, then 1 week na, 2 weeks okay ka, you will not develop this syphilis na. Remember, okay, 9 to 90 days. So almost 3 months yan. So after this, there is an ulcer formation. So in the primary syphilis, it is a single, painless, and well-defined Hunterian ulcer with clean-looking granulation tissue on the floor and indurated, and it's like a button-like. And hard chancre, it means heals with scar even without treatment. Okay, additional information. Sa HIV/AIDS, what is the confirmatory test? Is your Western blot assay. Your Western blot assay, sometimes ang result ng 2 months, 3 months, okay? But that is the confirmatory test. Your ELISA or the enzyme-linked immunoassay or the immunosorbent, okay, that is only a screening test. Okay? And ang screening test nyo, highly sensitive but less specific. That's why your ELISA or your EAI or the EIA is a screening test. And the confirmatory test is your Western blot assay. Okay, going back. On the primary syphilis, so commonly the sites are the genital by 90 to 95%. And here are the affected area, the coronal sulcus, the glans, the frenulum, the prepuce, and the shaft of the penis in male. In female, it could occur in the cervix, labia, the vulva, okay, the urethral orifice in the female. So when you say vulva, pag tinignan mo, yung female genital tract, externally, lahat na nakikita mong structure, that's your vulva. Okay? Another, exogenital could also occur in 5 to 10% of the cases, and the common site is in the lips due to oral sex. Another, for the diagnosis, combination of clinical and laboratory investigation. So we have this, okay, importante rito is your VDRL. Your VDRL or RPR are negative till 1 week after appearance of the ulcer. And again, your VDRL and RPR are only screening. They are not the confirmatory test. Kasi ang alam ng iba, pag VDRL, RPR nag-positive, alam na to, pasyente to may syphilis. No, it is only a screening test. And again, negative till 1 week after the appearance of the ulcer. And nagka-positive siya by the 4th week. Okay? So later we're going to discuss what is the confirmatory. So ito yung mga common din na ano niya. Okay? For the secondary syphilis, it occurs 6 to 8 weeks after appearance of the primary chancre. And you have a systemic disease. And constitutional features like the sore throat, the malaise, the fever, and joint pain may accompany the lesion. Another, the common site are the skin, okay, followed by lymphadenopathy or the mucosal lesion. When you say lymphadenopathy, it means enlarged lymph node. When you say lymphadenitis, it means inflamed lymph nodes. Okay, what is the difference, by the way, pag may mga itis tsaka fatigue? Diba? Gastropathy, gastritis. Okay? Pag may itis, there is a presence of neutrophil. Pero pag mga fatigue, gastropathy, lymphadenopathy, walang neutrophils dyan. Why? Because wala namang inflammation. Okay? Next, you have your secondary syphilis. You have your cutaneous. It means non-itchy lesion generally. There's a macular, papular, nodular, pustular, annular lesion may occur. Okay, you just review your assessment on the different skin lesion. Next, you have your condylomata lata. You have your split papule at the angles of the mouth, okay, the corona veneris, and moth-eaten alopecia. So again, pag sa mga board exam, nakita niyo yung moth-eaten alopecia, that's your secondary syphilis. Another, there is a mucosal lesion. So mucous patches or the snail tract ulcer. Okay, and it's a great imitator. Okay, okay, because actually this syphilis could also manifest na akala ng iba hindi syphilis, pero yung pala syphilis. Another, for the diagnosis, okay, VDRL and RPR are almost always positive. But this VDRL and RPR, okay, may give you a false negative and false positive. That's why hindi siya confirmatory test. It's just a screening test. Again, the specific test for your syphilis is your TPHA and your TPPA. Okay, may remain reactive throughout the life. Okay, so panghabang buhay na yan. Pag ang pasyente nyo nag-positive yan sa TPHA na yan, tsaka TPPA. Okay, they are more specific comparing with your VDRL and RPR. So for the latent syphilis, ibig sabihin ng latent, okay, the virus is replicating. Okay, or the bacteria is replicating but still the patient is asymptomatic. Ando doon siya. Okay, hindi lang siya nag-manifest, pero nag-replicate siya. So persistent seropositivity with clinical latency and following resolution of primary or secondary stage. Latency occur and continues as such in 60 to 70% of patients. And when we say less than 2 years, that is the early phase. And more than 2 years, that's your late phase. Okay, for the tertiary syphilis, okay, after a period of latency for up to 20 years. So pwedeng pasyente mo, walang simptomas ngayon. Pero after 20 years, doon pwedeng lumabas ang syphilis. Kaya nga ang STI, very interesting din siyang pag-aralan sa totoo lang. Kasi ano siya akala mo wala siya, pero pwede pa rin siya mag-occur in the future. Okay? So we have your cutaneous. Pag cutaneous, ibig sabihin sa skin. So characteristic lesion is the guma. Okay? That is a deep granulomatous process involving the epidermis secondarily and causes punch-out ulcerative lesion with white necrotic slough on the floor. On the legs, scalp face, and sternal area, doon mo sila makikita. Another, sa mga pasyente naman na may tertiary syphilis, cardiovascular system could be affected. Okay? So they could develop aortitis or the inflammation of the ascending aorta. Aortic aneurysm. When you say aneurysm, that is the dilatation or the ballooning of the artery. So pwedeng sumabog yan. And coronary ostial stenosis or narrowing of the blood vessel. Another, you have your neurosyphilis. So commonly ang neurosyphilis, ito yung mga pasyente na yung pupils nila sobrang liit. Okay? For the Argilson Robert pupil. So in the neurosyphilis, in any patient with syphilis, there is a CSF lymphocytosis. So an elevated CSF protein level or reactive VDRL test would suggest neurosyphilis and must be treated. Okay? And meron tayong asymptomatic neurosyphilis in which your patient will not manifest any signs and symptoms. And the meningeal neurosyphilis usually has its onset during secondary disease. And it is characterized by symptoms of headache, confusion, nausea, okay, vomiting, you have your neck stiffness, and photophobia. Okay? So what is the medical term for stiff neck? That's your nuchal rigidity. Okay? So cranial nerve palsy causes unilateral or bilateral facial weakness and sensorineural deafness. So, okay, no need for this. Okay. So, subtle deterioration in cognitive function and psychiatric symptoms. So, akala nyo, pasyente nyo psych, but yun pala, meron siyang tertiary syphilis. So, pwede yan. Another, okay, no need for this. So, for the management, so primary, secondary, and early latent, okay, recommended is your benzathine PENG. Okay, 2.4 million units. Pag yung mga million na yan, milligram lang yan. Okay? So, Doc, hindi po pa pwedeng PENG na lang. Wala ng benzathine. Preferred is benzathine PENG because mas mahaba yung half-life niya. Okay? And it's being given IM, STAT, or ASAP after the test dose. Another recommended is benzathine PENG. Okay? So, importante rito na at your level, alam nyo na drug of choice is your benzathine PENG. Okay? If you're going to talk the NCLEX, mas maganda, alam nyo how this medication being given. So, 2.4 million units IM, anti-negative skin test at 1 week, interval times 3 doses. Another, you have your aqueous crystalline penicillin. Okay? So, ayan siya. So, paano kung wala yung mga yun? You could give your doxy, okay, 100 milligrams BID, erythromycin 500 milligrams QDS. Okay, what do you mean by that? Pag BID, twice a day, QDS, 4 times a day. Okay, pag early syphilis for 15 days lang, but if that is late syphilis, okay, 30 days. So, pag pregnancy, only penicillin G can be given. Okay? And if patient is allergy, syempre, desensitize. Ibig sabihin, you give the medication pa rin, little by little, kasi syempre, they still need the medication. So, okay. We have this Jarvis-Herxheimer reaction. What do you mean by this? So, this reaction is an acute febrile reaction frequently accompanied by headache, myalgia, and fever and other symptoms that can occur within the first 24 hours after initiation of any therapy for syphilis. So, kung pasyente nyo, ginagamot ng syphilis, naka-doxy yan, naka-PENG, you monitor for the Jarvis-Herxheimer reaction. Okay? Para siyang flu-like symptoms. Kala niya lagnat pero, yun pala yung reaction. So, you could give antipyretic, can be used to manage the symptoms. And the reaction might induce early labor or cause fetal distress in pregnant women. But this should not prevent or delay the therapy. Okay? So that's it. So that's syphilis. Okay? So any question ba, nurses, before we move to hepatitis? So here naman in hepatitis, ang importanteng alam nyo dito, meron siyang 5 serotype. Okay? So, nag-load pa siya. So, ang hepatitis nyo, merong 5 serotype to. Your A, okay, the B, C, and D. So, when you say acute, it means sudden. So, ito importante, alam nyo to. Okay? So, A, B, C, and D. So, among these, sino yung fecal oral? It's your A and E. Sino yung bloodborne? B, C, and D. Okay? Sino yung percutaneous and perimucosal? B, C, and D. Sino may chronicity? B, C, and D. Okay? Sino yung merong pre- and post-exposure immunization? A and B. Okay? Tsaka D. And sino yung blood donor screening and risk behavior modification? Letter C. And ensure safe drinking water. It's still A and E. Okay? If you know the mode of transmission, very easy for you to know how to prevent. Okay? And you should remember that all of these are RNA except B. Your B is DNA. Among these, who is the defective virus? It's your hepatitis D. Okay, kasi itong D naka ano lang siya, parang nakasandal lang siya kay B. Okay? Doon lang siya nakasalalay. For the diagnosis, again, important is the patient history, the PE and the liver function test, and then the serology. So again, for the liver function test, those are your AST, ALT, okay? And for the symptoms, we have this pre-ecteric phase. And you say pre-ecteric, hindi pa dilaw pasyente nyo. Okay? These are the different manifestation. These are non-specific. Commonly, ang mga pasyenteng may liver problem, ang chief complaint is laging fatigue. Okay? Kaya nga, is possible, pinagpaparest sila. Okay, ecteric, pasyente nyo dilaw na. So, enlarged liver, that's why upon doing your abdominal examination, you should know the normal liver span. And you should know how to measure the liver. Another, tender upper quadrant, discomfort, and splenomegaly by 10 to 20% of the population, and general adenopathy. And for the post-ecteric phase, okay, mamonitor nyo rin. Another, for the lab finding, mataas yung liver function test nan or mataas, okay? So more than 5 to 10 times of the normal. And the markers for hepatitis B and C or E might be positive. So later we're going to discuss. And for the pathological finding, okay, panlobular infiltration with mononuclear cells, hepatic cell necrosis, and reticulum framework are intact. Okay, differential diagnosis means meron siyang katulad na sign and symptoms sa ibang sakit. Kaya pwedeng ma-interchange yung diagnosis or pag sabing differential diagnosis, parang kamukha niya, pero hindi siya. Okay? So infectious mononucleosis, what is the causative agent of your infectious mononucleosis or your kissing syndrome? It's your Epstein-Barr virus, EBV. Okay. So for the complication, the chronic hepatitis, okay, the fulminant hepatitis, and then the cirrhosis or this cirrhosis may lead to hepatocellular carcinoma or the HCC or hepatoma. Okay, when we say fulminant hepatitis, so by definition, hepatic failure within 8 weeks of onset of illness. And manifestation includes encephalopathy. Okay, due to toxins that being filtered by the liver, okay, it could go up towards the brain. It may lead to encephalopathy. And that is characterized by change in behavior, asterexis. Okay, so in Divine Health Assessment, what is asterexis? Parang nako-flap yung kamay. Okay, another, prolonged PT or your prothrombin time. On your anatomy, you have your intrinsic and extrinsic pathway, okay? And your prolonged prothrombin or your prothrombin measures your intrinsic pathway. Another, for the histopath, massive hepatic necrosis. Okay, so factors affecting the transmission is the replicate status. So later, i-discuss natin anong sabihin ng ABG antigen na yan, tsaka yung HBV DNA. And the route of infection, again, percutaneous and transmucosal. Okay, under microscope, itong itsura ng hepatitis virus. Okay, so hepatitis B serology. May mga makikita kayong laboratory test na makikita to. Okay, you have your anti-HBC exposure. Okay, so pag ang pasyente nyo positive siya sa HBC, okay, positive HBC IgM, ibig sabihin, ngayon, pasyente nyo may hepatitis. Pero pag HBC IgG, may hepatitis dati yan. Kaya nga, di ba, nung COVID, di ba, IgG positive siya, IgM. Kasi pag IgG, that's your secondary response. So, isabihin, noon pa, nagka-COVID yan. Pag positive sa IgM, ngayon may COVID because your IgM is a primary response. So, doon i-correlate. Ganyan yung pag-correlate sa mga immunoglobulins ninyo. Paano kung HB sa positive pasyente mo? Carrier. Okay? Positive siya sa HBs or anti-HBs, it means immunity. Okay? HB antigen, it means yung pasyente mo, right now, merong hepatitis yan and rapidly nag-replicate. Okay? O, anti-HBe, okay, seroconversion. HBV DNA, it means viral replication. Paano kung ang pasyente ninyo, positive HBC, okay, positive HBC IgM, positive HB antigen, positive HBV DNA. Ibig sabihin, pasyente nyo may infection ngayon and highly infectious. Okay? Ganun siya. Paano kung pasyente nyo naman is HBC IgG positive? Okay? Pero negative siya sa HB antigen, negative sa HBV DNA. Ibig sabihin, previously, pasyente yung nagkaroon ng hepatitis. Okay, isa pa. Pag ang pasyente nyo HB sub positive, ibig sabihin nan, pasyente nyo is carrier. Okay? Maganda dyan, kung pasyente nyo hindi nyo pa alam kung ano, ang pinakamaganda is pa-HB sub nyo siya. Pero ang pasyente is may pera, ipa-hepatitis profile ninyo siya. Okay? Para buo. So at your level, importanteng alam nyo kung ano ibig sabihin ng each one of that. Okay. Okay, for the hepatitis B, the mode of transmission is the sexual, the parenteral, and perinatal. And again, concentration of hepatitis B virus in various body fluid. Kaya nga, ang hepatitis B mo, ano rin to, STI din to. So high ang hepatitis B pag sa blood, sa serum or wound exudate. Moderate siya pag sa semen, vaginal fluid or saliva. And low and not detectable in urine, feces, sweat, tears, and the breast milk. Okay, so these are the different routes of your hepatitis B. Horizontal transmission, ibig sabihin from person to person. Tandaan nyo ha, pag horizontal, person to person. Pero pag vertical, from mother to the baby via placenta. Another, the perinatal transmission, the positive HB sag mother. Kung ang mother positive sa HB sag, ibig sabihin they are carrier of the infection. Okay? Kayo pwede kayo magpa-HB sag. I don't know kung doon sa assessment nyo sa school or doon sa PE nyo kasama yung hepatitis profile. And tsaka 'di ba, ang hepatitis B ilan ba ang ano nan? Ilan bang shot 'yan? 3, 'di ba? Then may booster siya every 5 years. But syempre, before dapat kayo magka-booster, pinapa-check mo na yung titer. Okay? Pinapa-titer mo na kayo para titignan kung mababa na or mataas. Kasi kung mataas pa 'yan, no need pa. Okay? Pero kung mababa na, pwede na. Okay? Another, the heterosexual transmission, male to female, illegal injection drug use, okay, contaminated equipment used for the therapeutic injection and other healthcare related procedure, and folk medicine practice. Okay, yung mga tandok, pwedeng maging ano rin yan, mode sila ng hepatitis. Another, bloodborne and blood products transfusion without prior skin. That's a primary reason, hindi kayo pwedeng agad-agad mag-donate ng dugo. Okay? Because syempre, di ba, pwedeng maging ano yan ng hepatitis. Okay, ito. Introducing the HBV vaccine in EPI program. Okay, an EPI, how many diseases that can be prevented by EPI? 7, di ba? You have diphtheria, pertussis, tetanus, polio, you have your measles, okay? HEPA, the TB, okay? So mandatory screening of blood donor and expatriates, and vaccination of risk group, and health education, especially among medical personnel. Okay? No need for this na. So immunization na yan. Community nyo yan. Okay, HCV infection. So transmission, again, injecting drug use. Commonly, mga nagpapatato. Okay? So hepatitis C. Clotting factors before viral inactivation. So transfusion, transplant from infected donor, and therapeutic contaminated equipment, and safe injection and practices, and occupational needle stick injury. Okay, so household transmission, ganun pa din, there but not absent, and could occur through percutaneous, mucosal, and exposure to blood. Okay, and others. So, okay. Actually, parang ano din to yung sa may table sa harap, nagbibigay ng example. So ito, yung mga hemodialysis, that's why kailangan malinis na maigay yung mga dialysis machine. Kasi syempre, pag ang pasyente mo, gumamit nun, may HEPA, madumi, yung machine hindi nalinis, kawawa yung susunod. Pwedeng malilipat sa kanila, yung HEPA. Okay? Same with others. Okay. Okay, for the prevention again, avoiding shared use of razor or brushes and any item that pierces the skin. Strict adherence of the universal precaution in health facility. Okay? So, syempre, pag HEPA yan, universal precaution, standard precaution pa din yan. Hand washing, okay? Mga ganon. Another, educating and training of the healthcare workers to the Philippines or your place. And then, syempre, the folk medicine. So for the, ayan, hepatitis A tayo, again, So, paano siya natatransmit? Close personal contact, household contact, the sex contact, okay, the child daycare center, and contaminated food, water, okay, infected food handlers, and the blood exposure, another, okay? And again, for the hepatitis A, 95% is fecal oral. Again, fecal oral, hindi oral fecal. It should be fecal oral. Person to person, contaminated food and water, the food, okay? Sometimes in less than 5% of population, it could occur in the infected blood and sexual route. Okay, again, standard standard precaution or the universal precaution, hand washing, sanitation, and you have your pre-exposure for the Hep A vaccine and the IV immunoglobulin. Again, means to control the Hep A, provision of clean water, proper disposal of feces, passive immunization, and active immunization. Okay? So, that's it. Yun lang. Okay, any question ba? Wala pa natin matapos, nurses. Okay, last na. Burn. So, meron akong in-upload doon sa group ninyo na image, study that. Okay? So, that is sa burn. Okay. So, sa burn naman, actually, dito, ang mga pasyenteng burn, if you're going to have it in the hospital, may sariling ward to. In Quirino Memorial Medical Center in QC, may silang ward, and sa totoo lang, mga patient na to medyo yung amoy, baho. Okay? Okay. So, number one, you have your chemical burn. So, what do you mean by chemical burn? It means it can occur whenever a toxic substance contacts the body. Okay, generally caused by strong acid and strong alkali. So, strong acid, what type of necrosis could occur? It's your cassation necrosis. Okay? Another, from the strong alkali, it could be liquefactive necrosis. Kaya nga, mas erosive ang alkaline mo. Why? Kasi kung ano yan, kung strong acid, maramdaman mo masakit, tanggalin mo. Comparing to alkali, matagal yung exposure niya. The greater or the matagal na exposure, the more yung damage. Okay? So example of this is your liquid SOSA. So the eyes are particularly vulnerable. So in your disaster nursing, once your third year, they're going to teach you what are the different first aid. So again, so the severity of the burn is directly related to the type of chemical, concentration of chemical, and duration of exposure. Wear appropriate chemical resistant glove and eye protection. So here, the management again, remove any chemical from the patient. So always brush dry chemical off the skin and clothing before flushing with water, and remove the patient's clothing. And for liquid chemical, immediately begin to flush the burn area with lots of water. Okay, for example, yung pasyente nyo sa mata. Okay, syempre kung tinamaan yan sa inner canthus, so paano ang linis nyo? From outer to inner, wag yun ang ikalat. Okay? O kung tinamaan siya sa outer canthus, saan ang linis nyo? Okay, start ang pag-irrigate nyo from the inner canthus para hindi nyo na kinakalat yung fluid. Okay? Wag nyo nang, sa totoo lang, from unaffected part to the affected part. Yun yung pag-irrigate. So, continue flooding the area for 15 to 20 minutes. Okay? After the patient says the burning pain has stopped. Commonly naman, pag sa mata to, pinapahiga sila. Okay? Again, from the unaffected part to affected part. So if the patient eye has been burned, hold the eyelid open while flooding the eye. Usually, plain NSS. For the electrical burn, may be the result of contact with high or low voltage electricity. So for electricity to flow, there must be a complete circuit between the source and then the ground. So any substance that prevents this circuit is called your insulator. And any substance that allow a current to flow is called your conductor. Next, the human body is a good conductor. Okay? The type of electric current, magnitude of current, and voltage have effect on the seriousness of the burn. And your safety is of particular importance. Never attempt to remove someone from an electrical source unless you are especially trained to do so. Lalo na syempre, kung sa ward may nasusunog doon or what, huwag kayong papakabayani kasi pag ang nurse nagkasakit or what, mas mamamablema yung mga pasyente. Kaya syempre, number one, safety niyo muna. Okay? Next, a burn injury appears where the electricity enters and exits the body. So ang electricity kasi may point of entry tsaka point of exit. Commonly, yung point of entry, ano yan, malinis. Point of exit, parang star, stellate-like, sabog ang itsura. Okay? And two dangers, there may be a large amount of deep tissue injury. The patient may go into cardiac or respiratory arrest from the electric shock. Di ba, ang heart niyo merong ano yan, conduction system. So, it could affect. So, ito siya. From the entrance wound, ganyan itsura niya, makinis or what, pero yung paglabas is what? Sobrang disrupted. Another, for the management, okay, tuturuan naman kayo nito. So, kung walang pulso ang pasyente nyo in adults, ay yung kakapain, carotid. Pag pedia, it's on the brachial artery. So, if indicated, begin CPR. Okay, 30:1. 30 compression, and then tubular external device. Anyway, tuturo naman sa inyo yan. And be prepared to defibrillate if necessary. So, hindi lahat ng case, dinidefibrillate or yung parang kuryente sa telenovela. Dalawang case lang ang dinidefibrillate. You have your ventricular tachycardia or the VTAC and your ventricular fibrillation or your BFib. Yung dalawa lang ang dinidefib. Wala nang iba pa. So kung yung pasyente mapatay na, wag mong i-defib. Mas lalo mag-assist tuloy yan, mag-dediretso ang linya nun. Okay? Give supplemental oxygen and monitor and treat the soft tissue injury with dry, sterile dressing and provide prompt transport. Okay, for the thermal burn, it is caused by heat. So most commonly, they are caused by scald or open flame. A flame burn is very often a deep burn. It is a hot liquid produces scald injury. So coming in contact with hot object produces a contact burn. So for the thermal burn, again, a steam burn can produce a topical burn. A flash burn is produced by explosion. Commonly, yung mga nagdidinamita sa dagat. Another, may briefly expose a person to very intense heat. Lightning strike can cause a flash burn, mga nakidlatan. And commonly here in the Philippines, pag mga pasyente burn, okay, ang ginagamit is the silver sulfasalazine. I don't know if you encountered that, but sa mga burn yan, silver sulfasalazine. Siguro per ointment yun eh. Per tube is 700 pesos. Another, management stop the burning source, cool the burnt area, and remove all jewelry. Another, you should increase the exposure time. Okay, again, increase the exposure time will increase the damage to the patient. That's why dapat matanggal nyo agad yung pasyente from that burn. Another, all patients should have a dry dressing applied to maintain body temperature, prevent infection, and provide comfort. Sa totoo lang, kung nagdalagay rin kayo ng gas sa mga pasyente nyo, mas maganda yung mga ready-made na or yung for example, yung gasa na itsura dapat may butas sa gitna. Mas maganda yung nabibili na may butas sa gitna. Hindi na yung gugupit pa kayo ng gasa, bubutasan nyo sa gitna. Bakit? Yung gilid nun parang nagtatanggal-tanggal, nagtutuklap-tuklap yung gasa. So kumakapit sa sugat. So mas mahirap siya tanggalin. So mas maganda, yung mga ready-made na gasa na lang. Another, your inhalation burn. It could occur when burning takes place in enclosed space with ventilation. Commonly, sa mga nasusunog. Ano pa? Sa garahe, yung mga ganyan. So upper airway damage is often associated with inhalation of superheated gases. Sometimes, yung mga pasyente, pag ang sunog dyan is the head and neck, okay, on your rule of 9, di ba? Sila yung most na life-threatening kasi syempre yung airway could be compromised pag yung burn is na side and neck. Okay, another, lower airway damage is more often associated with inhalation of chemical and particulate matter. Another, you may encounter severe upper airway swelling requiring intervention immediately. Consider your backup. Okay, anyway, the combustion process produces a variety of toxic gases. Okay, carbon monoxide intoxication should be considered whenever a group of people in the same place all report a headache or nausea. Common ditong carbon monoxide, pag natutulog kayo sa kotse, okay, nasusunog yung bahay, nasa garage kayo, nakabukas yung kotse, okay, ang management dito is oxygen. Why? Go back to your respiratory system. Your oxygen will remove the carbon dioxide. So 100% auto to, okay? So, ayan, tatanggalin niya yung carbon dioxide sa body mo. You just give O2 supplementation. Okay? So, ayun. Pero syempre, i-assess pa rin naman ito. Another, management, first ensure your own safety and the safety of your coworker. Another, pre-hospital treatment for a patient with suspected hydrogen cyanide poisoning includes decontamination and supportive care. So care of any toxic gas exposure includes recognition, identification, and supportive treatment. Okay, here in Manila, if there's any cases from different hospital about toxicity or what, tumatawag sila sa PGH. Okay? Meron din sa ISAV for the toxic pero commonly sa PGH. Then, nagbibigay ng orders yung doctors kung anong ginawa, okay? So, anong role ng nurse doon? Siyempre, pag i-transfer yung pasyente, dapat alam ng nurse yung ginawa sa pasyente at bakit siya ginawa. Okay? Another, for the potential threats include incidents related to the use and transportation of radioactive isotope and intentionally released radioactivity in terrorist attack. So you must determine if there has been a radiation exposure and then whether ongoing exposure continues to exist. Okay, for the radiation burn, there are three types, alpha, beta, and gamma. So alpha, little penetrating energy and easily stopped by the skin. And for the beta, greater penetrating power but blocked by simple protecting clothing. And for the gamma, very penetrating, easily passed to the body and solid material. Okay. For the most ionizing radiation accident involved the gamma radiation or the X-ray. And the management, again, patient with radioactive source on their body must be initially cared by the hazmat responder, or those are the people who is well trained to handle those cases. And irrigate the open wound and notify the emergency department. Again, for the management, identify the radioactive source and the length of the patient exposure to it. Because the more na naka-expose sila doon ng matagal, the more na damage. Limit your duration of exposure and increase your distance from the source. And attempt to place shielding between yourself and source of the gamma radiation. That's why pag nasa X-ray nga din, di ba? Dapat naka-cover. Commonly dapat dyan naka-cover is the in-male genital area. Okay? Because syempre yung parang di masira yung quality ng sperm. As a female, ganun din, the genital area naka-cover. Another, for the pain assessment or patient assessment, when you're assessing a burn, it is important for you to classify the victim's burn. And classification involves determining the source, the depth, and severity. Commonly, itong mga pasyenteng nagbaburn, binibigyan ba ng antibiotic? No, unless they are superimposed with bacterial infection. Kasi sterile to eh. Okay, nasunog, di ba? Pag nasunog minsan, malinis yan, walang bacteria. Bibigyan lang ng antibiotic if there are superimposed bacterial infection. E paano daw kung nabigyan to ng antibiotic, wala namang infection? They could develop fungal infection. Okay? That's why hindi agad nag-antibiotic dito. Another, patient assessment, okay, step. You have your scene size up, primary assessment, history taking, secondary assessment, and reassessment. So secondary assessment, parang reassessment din yun. Okay, for the scene size up, you're going to check the scene safety, okay, and mechanism of injury and the nature of the illness. So, kung mag-take sa surgery, ang history taking doon is your NOI, POI, TOI, DOI. What is NOI? Nature of incidence. The TOI, the time of incidence. POI, the place of incidence, okay? And the DOI, the date of incidence. NOI, TOI, POI, DOI, okay? If you're going to read the Carl Ibalita review book, kasama siya doon. The NOI, TOI, POI, DOI, okay? So, yan, please alam nyo. Another, for the primary assessment, to begin with the rapid scan. So, ito yung, pagdating ng pasyente sa inyo, mabilis ang assessment nyo. Ito, kailangan ng oxygen, lagyan ng oxygen. Okay? From a general impression, okay, itong pasyenteng to, mukhang mag-a-arrest, ihanda ko na yung mga norepinephrine or dopamine. Okay? Be suspicion of clues that may indicate the abuse. Baka naman yung pasyente, hindi naman talaga nasunog lang, baka sinunog. And that should be reported within the first 24 hours sa sheriff or sa mga pulis. Kasi kung hindi, tapos nakita yung nakadocument sa chart, baka pati kayo makasuhan. Another, consider the need for manual spinal stabilization. Kung pasyente nyo, merong spinal fracture, lug roll. Usually yon ang ginagawa dyan, lug rolling. Another, check for the, okay, mamaya discuss natin yan. For the primary assessment, you have your airway and breathing. It will ensure that the patient has a clear and patent airway. Lagi naman yan eh, maintain the patient airway, number 1 yan. Aside from patient safety. So number one yan, airway safety, okay? And be alert for signs that the patient has inhaled hot gases or vapor. Okay, seeing facial hair or yung sunog, yung mga facial hair, and soot present in and around the airway. For the primary assessment, again, copious secretion and frequent coughing may indicate a respiratory burn. And for the circulation, assess the pulse and rate and quality. Determine perfusion based on the patient's skin condition, color, temperature, and capillary refill time. Okay, what's the normal capillary refill time? It should be less than 2 seconds. Okay. Next, for the control for the significant bleeding and assess for signs of shock. Another, for the transport decision. Okay, importante, you're going to note the 5 signs of inflammation. Okay, others. So you're going to investigate, okay? And again, sample history. Are you having any difficulty of breathing, swallowing, or any pain? So dito again, papakinabangan niyo yung health assessment niyo. Kaya sobrang important ng health assessment. Kasi until mag-practice kayo, yan ang pinakamagagamit nyo. Tsaka anatomy. Okay, next. For the physical exam, perform a full body scan again and physical examination mo sa cephalocaudal from head to toe. Make a rough estimate or the total or the BSA or the body surface area, okay, using the rule of 9 and extent of the burn area. Okay, reading assignment, you read about the rule of 9 and determine the classification of the burn and determine the severity of the burn and package the patient for transport. And for secondary assessment, the primary reason ng secondary assessment mo is to know if yung mga management na ginawa mo during the primary assessment is nag-take place or na-address ba yung pasyente mo. Kasi kung hindi, so magbabago ka ng management mo. Okay? So, ayun siya. So, reassess the patient. You're going to evaluate, reassess the chief complaint, and others. So, ganun lang din naman siya. Okay. So, ito. So, we have this dressing and bandaging. So all wounds require bandaging. So sometimes splint can help control bleeding and provide firm support for dressing. And there are many different types of dressing and bandages. And for the dressing and bandages have 3 functions: to control the bleeding, to protect the wound from further damage, and to prevent further contamination and infection. And again, tandaan nyo to, most wound will be covered by universal dressing. Okay, so the conventional is 4x4 and 4x8 gauze pad. Okay, kung di man matanong sa exam, baka sa NLE or NCLEX, lumabas. Okay, assorted small adhesive type dressing and soft self-adherent roller dressing. And for the universal dressing are ideal for covering the large open wound. And again, gauze pads are appropriate for smaller wounds, and adhesive type dressing are useful for minor wounds. And occlusive dressing prevent air and liquid from entering or exiting the wound. Okay, and for the bandages again, to keep dressing in place during transport, you can use the soft roller bandages, the rolls of gauze, triangular bandage, and adhesive tape. And the self-adherent soft roller bandage are easiest to use. Okay, so adhesive tape holds the small dressing in place and help to secure larger dressing. And do not use elastic bandage to secure dressing. So the bandage may become a tourniquet and cause further damage. Again, splints are useful in stabilizing the broken extremities and can be used with dressing to help control the bleeding from soft tissue injury. If a wound continues to bleed despite the use of direct pressure, quickly proceed to the use of a tourniquet. Okay, so that's it. Any question ba, nurses? So by the way, each of your examination by next week is only the topic, okay, that I posted. So ito lang ha, yan yung pointers nyo. So perioperative nursing, kidney disease, hypertension, pneumonia, TB, hepatitis, GBS, STD, burn, COPD, and asthma. Okay, and your exam is 40 items, multiple choice. And the exam type is NLE, NCLEX, and it's more an application. Okay, my question ba, nurses? I know you're tired na.
Wala po, sir.
Saan po?
Wala naman po, sir.
So
Wala
later,
po.
okay. So later, I'm going to post the highest sa quiz for the prelim. Okay, so ayun siya. So let's see again on midterm, okay? So I hope during this filling period, madami na akong na-share sa iyo at sana may natutunan kayo kahit paano on our discussion. Okay? Sige, ayan. May question pa ba kayo? If wala na kayong question, we call it a day na. Okay? So sa inyo may hindi nakapag-exam na dalawa, I don't know why. 39 lang yung nagsabit ng exam. Okay. Sige ha?
Sir, si Mia po nag-drop out na po ata ulit.
Sinong Mia? Mia?
Nagit po.
Bakit nag-drop out na to? Di ba kakapasok lang nito? Totoo? Nag-drop out na sinagit agad?
Opo, sir.
Ano naman? Okay, sige. Sino pa? So 40 na lang pala kayo. So may hindi pa isang nag-exam. Kawawa naman si Nagit, kakapasok lang nito. Okay, andiyan pa ba si Sadiz? Okay, sige, anyway. Sige, ganun.
Yes po.
Oo, sige. Ganun na lang ha. Basta good luck and God bless your exam next week. Mag-start tayo at 5 p.m. and mag-end at 7 p.m. 2 hours. Okay? So exam lang yun. Wala naman tayong discussion. Mag-discuss lang tayo next week. Okay? Sige. You just wait for the scores nyo. Okay? Sige. Good night na. Bye-bye.
Thank you po.
Thank you, sir. Bye-bye. Good night.
Bye-bye.
Thank you po.